Anyone who's experienced it knows that back pain is no fun. It can keep you down physically as well as emotionally.
But the upside is that there are some things that you can do to prevent it, and if it occurs, treat it. So on this week's Health Talk, an expert in back and neck surgery will share some very important and useful tips.
Some of them may surprise you, so stay tuned for an interesting discussion.
Andrea and I are up next. Hello, I'm Dr. Eric Mazur.
And I'm Dr. Andrea Peterson. Today we're talking about back pain, which according to a recent study is one of the top 5 reasons that people see a doctor.
We've invited Dr. Neel Shah to join us to shed some light on this very important and ubiquitous topic. Dr. Shah is a a neck and back specialist with Danbury Hospital. And so everybody comes into you complaining about their aching back or neck, is that right?
It's true. I think back pain is a pretty common reason to go to the hospital or to see your primary care doctor nowadays.
How'd you get interested? You're a young guy, you look athletic. How'd you get interested in back and neck pain?
Well, I started my journey going through medical school and then decided to go to orthopedic surgery. And then from there I decided, I really like treating patients with conditions affecting their neck and their lower back, and that's how I ended up in spine surgery.
Do you ever find it frustrating? Because it is so common, and treatments can be tremendously relieving, but people have back pain and neck pain through their whole lives.
I think that's one of the reasons I really went into it. I really like the psychological aspect of treating patients that have had chronic back pain or even an acute episode of back pain, because it really can debilitate you, and kind of seeing patients go from step A to step B to getting better, I think is really a nice thing to see.
What are some of the common causes for people to develop back and neck pain?
So, a lot of the common causes, I think, are deconditioning are one of the biggest ones. I think the New York Times put out a great article stating that sitting is the new smoking. And I think society nowadays, we sit a lot more than we probably used to. And I think
we have remotes now. We don't even have to get up to chase the channel.
Exactly.
I remember the days.
We can order everything online too. We don't have to go to the store anymore. So I think that that leads us to have weaker core musculature as well as weaker hamstrings and quads, and I think and gluteus muscles. So I think that really can cause more stress on our lumbar spine and the muscles of our back.
Tell us a little bit more about what you mean by core musculature for people at home that may not be familiar with those terms.
So I think it doesn't make sense sometimes, but core musculature is really your abdominal muscles and the muscles around the girdle of your abdomen, as well as your legs, and that they should be supporting a lot of your back and your posture. And as we sit more, they kind of waste away, because as you sit, you don't really activate many of your muscles.
And so then, what happens that then leads to the back pain?
I think it's an ongoing issue of research, but we don't really know a lot. But what we can postulate is that our paraspinal muscles, the muscles that kind of support our back, kind of take on more of the work than they really should. And I think that as you sit, they also don't work, and so they're kind of wasting away as well.
So that means they can be sprained more easily, or twisted more easily.
Right.
But then also the back and neck turn out to be pretty complex structures. I mean, people think they all know what skeletons look like, but the way that weight is borne and transferred is pretty complicated. Do you want to say some things about that?
Sure, there are. There's 3 curves to our spine. Our neck, our cervical region has a curve. Our thoracic region has another curve, which is compensatory, and then our lumbar region has another curve. So they all play off of each other. So one curve being thrown off, and that is all in relation to our pelvis and the way our pelvis is tilted. So if one of those is thrown off, it kind of throws off the balance of our entire posture, and then obviously gravity affects a lot of that, and that can lead to a lot of problems.
What about, people have heard about problems with discs in their back. Can you talk a little bit about that?
Sure. Our vertebral discs are kind of like the shock absorbers and the motion segments that allow the bones to move upon each other. They're made of kind of an outer layer, which is a strong tire. I like to equate it to a jelly donut. It's an outer layer, which is hard, and then a jelly in the middle, which allows motion. And what can happen is, over time, they're going to start degenerating no matter what. It's the aging process. But once the outer wall starts getting weak, some of the jelly can sometimes come out. And that's disc herniation, a ruptured disc. They're all kind of the same thing. And what that really means is that a nerve will be pinched or squeezed because there's no space for it to come out where the jelly came out. And that can cause anywhere, if it's in your neck, it can cause arm pain. And if it's in your leg, it can cause leg pain. And if it's very bad, it can cause numbness, tingling, or weakness.
And that's what we call the leg, something generically we call it sciatica,
Right.
even though it's not necessarily maybe part of the sciatic nerve, but it's actually coming from the nerve roots back.
Exactly. So those nerve roots make up your sciatic nerve, and they also make up your femoral nerve, so it doesn't always have to be in the back of your leg. It can be in the front of your leg or whatnot as well.
There are things called facets, which help, and I've also heard about facet degenerative disease
Sure.
and then foraminal impingement.
Right.
Could you sort of go through some of those structures
Yeah.
and how they give you pain syndromes in the
course.
back and neck?
So the facets are the joints of our back. Just like our knees or the joints in our hands, they are lined by cartilage, and as we age, that cartilage degenerates, and eventually...
And they move, yeah. As
Yeah.
you said, they're joints, and they allow the back to move.
Exactly. They allow your back, the bones of your back to move. And as joints all do, just like your knees and hips, they start degenerating, and you end up on the term of bone on bone, which is when there's no more cartilage left.
And that hurts.
And that hurts. And that usually just causes back pain. And it's, unfortunately, we haven't developed joint replacements for our facet joints, but the treatment for that is usually conservative, sticking with physical therapy and anti-inflammatory medications.
So you've talked about various causes of back pain, and maybe you can talk a little bit about general prevention strategies.
Yeah, let's go back.
Sure. Yeah.
Young people out there, or the parents of young people,
Right.
how do they keep the men from ending up like we are?
Like I like telling most of my patients, and I don't like saying this, but I think it's true that chronic back pain is somewhat of a back pain is somewhat of a chronic disease that I think everyone will experience at least once or twice in their lives, just because we are active people. And I think the best way to prevent it is to keep keep your core musculature strong, work on a good posture. So I think when your mother yells at you to sit up straight, she was right. And then,
Yes. So what is good posture? I mean, is it?
I don't think it's completely
You
sticking your
don't
chest out.
mean walking around the room with a book on your head, or?
Yeah, I don't know if it's that, but I think just sitting up straight, not slouching over. The biggest thing nowadays are cell phones and computers, so not constantly having your neck arched forward, because that does put a lot of strain, especially on your neck. And I think we've started to see more instances of kids and people who are younger having a lot more neck and upper back pain.
Are you seeing as much problems with the ergonomics of people working at computers all the time?
I
Because I find it in my own home, when I'm spend a lot of time on the computer, I guess the way my seat is, I'm like this, and I'm always stiff when I get up after that.
Right. No, I think that's definitely become a problem, and our heads are heavy. So when we're sitting up straight and your head is aligned with the rest of your spine, your body is not doing any work keeping it up. But as you start bending over more, the gravity starts pulling it down, and it's out of alignment. So the muscles in the back of your neck and upper back are...
So should the computer screen be at the level of your eyes?
I think the newer trend are stand-up desks, right?
Yeah, I've seen them advertised.
Yeah, and I think a lot of my patients too. I'll give them notes to allow their work to supply them a stand-up desk, or one that goes from sitting to standing, so they can change.
So
position
vary the
as needed.
position during
Yeah.
the day.
If people don't have that, do you find that getting up and walking periodically once an hour, getting out of the chair helps?
And I think with our smartwatches and whatnot nowadays, it's easy to kind of program maybe every 45 minutes for just a little buzzer to go off to remind you to take a lap around the office, so you're not sitting for more than 45 minutes to an hour at a time.
What about sports for kids? And I think back to the days I played football as a kid. I took a lot of pounding in my spine.
Yeah.
Then, are there and yet you don't want sedentary kids either.
No.
Where's the right balance there? Are there certain sports that are worse than others? My granddaughters do gymnastics with an incredible amount of twisting and
Right.
impact. What are your thoughts on that in terms of prevention for later in life?
I think some of the, when it comes to gymnastics and some of the other sports we talk about are horse riding, where that comes into play are the injuries when you fall on your head or fall on your back. But then the other sports like lacrosse, football, hockey are more high impact. So I think they are a little bit more wear and tear on your back. So obviously you have to find somewhat of a fine line, because we do want our kids to be more active nowadays and not sit on a computer or tablet.
I would think that then core strengthening would be all that much more important for
yeah.
kids that are involved in impact sports that might involve their back or their neck.
Yeah, and proper form, and I think is the biggest thing, because a lot of the exercises they do nowadays, if you're not having the right form, can kind of lead to even further problems. I think exercise like CrossFit and doing more of the Olympic style weightlifting has become more popular. We are seeing a lot more injuries because patients are trying to put up a lot more weight than they may be able to, and their form may be off. So I think working on your form is more important than actually putting them out, putting up that much weight.
Talking a little bit about kids, we've talked about their sports and also about cell phones and kind of leaning down. What about things they have to do, like bringing books to school? Are we seeing backpack, related
That's
injuries
right. I don't see,
and
there's not a kid
strains
that goes to school without a backpack anymore, is there?
Well, I think I've seen a little bit of a shift because first of all, that's a conversation I hate having, because when the kid's in a room, she's having, or him or her is having back pain, I have to tell him or her that they need a rolling backpack. They're not usually very happy about that. But, I've done that, and it seems like it's helped a lot of times. But I think now that kids are going to tablets or laptops, the amount they really have to carry has really decreased. And I guess it really just depends on the school they're going to and what they have there.
Are backpacks so bad for kids?
I think they're okay as long as they're balanced properly. Obviously, they're not going to wear both straps with the front strap. They like to wear them on one strap. I don't think that's good for your back, but I think if it's worn properly, it's quite okay.
Should kids be doing back strengthening exercise?
I think just being an active kid is fine for their age. Obviously, nowadays with laptops and tablets, they become more sedentary, which may lead to further injury. So just normal activity will probably keep them good.
The other thing that comes with activity, especially as we grow older, often is weight control. Can you talk about any connection between weight and back pain?
Sure. I mean, weight will obviously increase the amount of forces all of our joints see. So that will definitely predispose our cartilage to wear out faster. And also, what goes along with weight gain is that they're sedentary. So that means their muscles are probably deconditioned. So I think that will also lead to more back strains and back problems as they grow up. And
does it also disrupt the curvature, since you're changing the center of balance with a big belly?
Not so much. I think it's more about just like the musculature being kind of deconditioned and not as strong as it probably should be.
Do you recommend specific kinds of exercise? Running versus swimming versus, I don't know, planks?
I think planks are great, but obviously your form should be good. So I think when it comes down to any exercise, your form should be the number one thing, making sure you're not compensating. If you can't do a full push-up, then, do them on your knees until you can do a full push-up, instead of trying to muster a push-up up, like using every muscle in your body. But I think planks are great. Swimming is great too, but you do need to do some sort of weight-bearing activity, because if all you do is swim, your bones aren't seeing the stimulus to grow, so they may become weaker.
People don't realize that. Maybe you could emphasize that a little bit more.
Yeah, so I think weight training is actually very important, because, like I said, if you just swim, your body doesn't see the gravity that it needs to, and see the kind of...
It's like being weightlessness in space.
Exactly.
People don't realize that the actual, pressure on the bone stimulates bone growth and bone density.
Exactly, yeah.
So it's a very real phenomenon that folks don't realize. Running went through a tremendous wave. I don't know whether people are running quite as much as they used to.
Sure.
But I did that for a while, and it seems like there's a lot of stress, repetitive stress on the back doing that.
Back and knees do see a lot of stress with running. I think it's better to run on like turf or grass rather than the road. And then obviously, your form should be good, so you shouldn't be slouching over. You should, keep a good form as you run, and then. And I think
shoes, I would presume.
Good shoes are definitely very important too.
Right. Well, this has been a show full of really great
tips.
Practical tips, and we thank you so much for coming on.
Unfortunately,
today.
we've run out of time, Neel. So thanks again for this informative information.
You.
Help people at home keep away from back pain.
And to our viewers, thank you for watching. Please remember to send us your questions and comments to healthtalk@wchn.org.
Remember, we've got your back.